There are some interesting statistics associated with curve progression in the adolescent stage. And we know as curves go into the pubescent growth spurt, this is when the most likely are going to progress. And what we know is when curves enter the pubescent growth spurt and the curves are less than 25 degrees, we know one of every three of those curves are more likely to progress to surgical standards by the time they're done growing. So the majority don't progress to severe standards, but 30% or so would, or 33%. So therefore, in these cases, a lot of times they recommend do nothing and just watch it, which something I'm not for, but it's something that the traditional approaches tend to do. Once your curve breaks 25 degrees, but less than 40 degrees, and you're in this moderate category, now the statistics double. They say about 60 to 65% of your cases will progress now to surgical standards by the time they're done growing, and they're entering puberty in this range between 25 and 40 degrees, and now only 1/3 won't progress to severe standards. So here they're more likely to recommend any type of treatment. I would also recommend treating this curve because it's more likely going to progress. And then once you break 45 degrees and you're still growing, they say it's 96% chance that your curve will continue to worsen as you grow. So these cases are very often recommended surgery. However, in these cases, we can still treat the curves conservatively to reduce the curve. And these are the statistics that we know associated with curve progression entering puberty with either a severe or a moderate or a mild curvature.